citizen, but I hailed from the Philippines, and I've been doing medical missionary work almost half of my life. I'm 59 years old, and I'm very thankful that MedShare helped our organization. I'm the founder of the Beautiful Heart Foundation, which is the integral ministry of the Holy Catholic Church International. I would like to just present a short background of our foundation through the write-up of the Most Reverend Father or Bishop Ewart from Pennsylvania. So this is what, before he passed away last December 17, 2018, this is one of his write-ups about the Beautiful Heart Foundation. This is a comprehensive ministry to the Philippines and beyond, and was founded by myself, Dr. Anacleto Belleza Millendez, a deeply spiritual Catholic physician. In addition to free health care for the poor, Dr. Millendez acts as both an educator and a defender of the poor in many ways. He is an advocate of holistic health defined in the best possible way. He believes in helping the poor help themselves by opening doors to professional educations such as nursing, but also to the practical learning required for living a healthy life. Life, he believes, must include the practice of one's faith, plus good health habits and hard work. Work, he believes, gives mankind a dignity. So when the doctor delivers medical care, he requires that the patient also do something for himself, that is, take action toward a healthier lifestyle. I teach people to fish, the doctor says. He holds to the old cliche that the best things in life are free, but he qualifies that statement by urging all to care for these elements in the world that are free but are endangered. Air and water are available to all, but they are treated with recklessness. Dr. Millendez, which is myself, is always in need of donations, not only financial but also medicinal. He believes the supply of pharmaceutical medicines could be far more generously shared. Now, through MedShare, I found a big nonprofit organization in the East Coast, the Brothers Brother Foundation, which the former director introduced me to that organization. And Brothers Brother Foundation donated almost $1 million worth of retail value of medicines to our organizations since 2009. And MedShare, over the last maybe 9-10 years, been supporting us, not through pharmaceutical donations, but medical supplies, which you all guys are helping in putting this together. Just to give you an example, these medical supplies, like say gauze, bandage, IV tubings, needles, catheters, are not commonly used in a typical medical missions. But what I do is I share it to some other non-profit organizations in the Philippines. In the Philippines, our healthcare system is not good as here in the United States. Especially that we are composed of 7,109 islands, and most of those islands are hard to reach, medically underserved. Though we export our best nurses and doctors here in the United States, but in the far-flung islands, we don't have much state-of-the-art healthcare. Now, I work closely with volunteer rescuers or responders who are based in Metro Manila and in big cities, but they don't have supplies. So what I do is I share those gauze, bandages, and they are a big help when they rescue or when they respond in the streets during accidents. So I train them how to use those supplies, and the ones that are really useful in hospitals I shared those, like the IV tubings, the needles. I shared those to public hospitals, where most of the time patients would share beds. 3 patients would share in one bed. Some patients would even be on the floor. So, and I'm hoping that in the very near future, we will be able to raise at least 25,000 US dollars so that we can bring those beds here, even ventilators. You can see over there that patients are being ambu-bagged manually by family members because we don't have enough ventilators. Can you imagine patients, their own family members who are not even trained are the ones doing the manual ambu-bagging. So we are really in dire need of those ventilators. Incubators for babies, premature. Some of them survive by just mere lamp in the islands. Mere bulbs. And sometimes babies are delivered anywhere. Can you imagine? I don't know if you're familiar with the islands of the Philippines. We're a small country. Okay, where is the Pacific?
It wraps around, so it's either
somewhere.
Oh, here, yeah.
So it's a small country.
MedShare sent
7,109 islands during low tide. But I enjoy doing medical. As I've said, I have gone to at least maybe 20 islands. And my goal is, before I die, I will reach even 50 islands. And you know, when you go to these different islands, it's like medical tourism activity because you can see the beauty of the beaches, the mountains. People are very polite, courteous, respectable, warm, easy to be trained. In fact, we're pushing for telemedicine in these islands, where I will set up cameras in the far-flung islands so that we can see patients and they can consult us. My group of team doctors and nurses can tell them exactly what to do. And I will call this Barefoot Doctor Institute, coined after the Chinese idea of a barefoot doctor. Now I will show you an example of a typical medical mission which happened last September 28. The beneficiaries are poor squatters who were relocated in this village. I collaborated with another faith-based organization. I was asked to reduce it in a 5-minute video.
This is the right one.
So, if repacking starts here in a typical weekdays or weekend, when it gets to the Philippines, another set of repacking will take place, putting the medicines into small plastic bags with labels on it, so that by the time we get to the islands or to these depressed communities, it's easy to distribute. And normally for a typical morning medical mission, when there is only one doctor, we can cater to 50 to 100 patients with some volunteers. So we get all sorts of diseases. Number one is infectious diseases. We still have very high cases of tuberculosis, dengue, respiratory, gastrointestinal, urinary tract infections, skin infections. We have also high cases of metabolic syndrome such as diabetes, heart disease, hypertension. Cancer is becoming very prevalent, especially among women breast cancer, reproductive cancers, ovarian, uterine. Males have high on prostate cancer, lung cancer.
You said becoming
So
more
I usually collaborate with professional healthcare. The old lady is 75-year-old, a retired nursing dean, but still very active, helping in medical missions. She started teaching, I think, right after graduation from nursing school, undergrad nursing, and then she retired as a dean in a graduate nursing program. We do a lot of
It's just we can't get you here and over there.
Oh,
So
okay.
if you want to be in the video, there you go.
a typical medical mission usually starts with introducing all the participants to give importance, from the volunteers to the healthcare providers, and even the pastors or the priests who would start the medical mission with a prayer. Because our approach is not only physical wellness, but also psychological, mental, and spiritual wellness. So it's more of holistic kind of medical mission. People who have spiritual problems are being counseled, guided, prayed for. We push for alternative medicine as well. That's why we teach them how to plant vegetables, fruits, even herbs that we find effective, such as ashitaba. The fruits would be mangosteen, those high in antioxidants. We encourage them to observe environmental sanitation because, that's where we get all the germs. In fact, I even check the nails of children. I would ask them to line up and check the fingernails. So public health education is very important in our medical mission. It may look like as if it's dole out because you're giving free medicines and supplies, but what is important is they will learn. They will learn public health education, that most of diseases are preventable. Even hypertension and heart disease. We would start even with an exercise program in a typical medical mission where there's Zumba. And we also encourage them to have relaxation techniques like singing. I do sing with my patients because singing is relaxing. We know that stress, we would emphasize to them that number one killer these days is not heart attack or brain attack or stroke. The number one killer these days is stress. So they should know how to manage their stress. And there are so many ways. One, of course, is prayer. And other than prayer, gardening is another one. Vegetable gardening. So we push for what we call as another ministry, Project Green Ministries, as part of our programs. Green is an acronym meaning God reminds everyone to enjoy nature. Green, God reminds everyone to enjoy nature. So this is a typical woman with, you can look at obese, so she has hypertension, she has heart disease, she has palpitation. So that day, it was a morning affair, and we were able to look at around 50 to 60 poor patients, from the senior members and kids as well. Now let me close my talk by sharing my interaction with the staff and management of MedShare. The first one, when they helped us during Typhoon Haiyan, which was 2013.
So MedShare 1.
Yeah, the MedShare one.
I did here at
warehouse of MedShare through the courtesy of our friend here, Shana, and of course my friend here, another volunteer, Luz. And Shana, would you kindly tell us briefly what is MedShare all about?
Well, MedShare takes medical supplies and equipment from hospitals and manufacturers, and they're usually thought of as surplus for the hospital. We bring it all back here. We've got volunteers. They're on break right now, but shortly they'll be out here and they'll be sorting all these supplies. And we make them available for medical teams to take them to places like the Philippines and all these places around the world. And we also make the supplies available to ship out on big 40-foot containers. We've shipped to 95 countries so far, and hundreds and hundreds of medical teams all over the world. And we're really happy to help you guys out today.
Yeah, actually, we've been volunteering also our time. Those I'm inviting you to join the group. They're looking for volunteers to help out, sort out the different donations that they have. And as the founder of the Beautiful Heart Foundation, we were also receiving some donations from this beautiful and very supportive company. Today we are here to again ask for more. Actually, a week ago, the head Ken Rogers turned in like 3 boxes of donations, which we already sent in the Philippines this morning. So we are very thankful to the MedShare, of course to Ken Rogers and Shannon for helping out the poor victims of typhoon in the Philippines. And of course, Luz, your last words to our friends here in
Well, I'll
MedShare.
be here and we'll help out.
We love it. Thank you so much.
Yes.
And we're glad to be here to help you guys out.
Yeah, and once again, Shannon, thank you for your support over the years.
Thank you.
Yeah, this is our, I think, second year to be receiving donations from MedShare. So, God bless, and let's keep on moving now.
Let's fill those boxes.
Okay.
And last year there was another big typhoon that hit the Philippines, and also MedShare gave us 2 boxes, like 50 pounds, 50 pounds. So I have a souvenir of that donation.
Okay, good afternoon. My name is Dr. Anacleto Belleza Millendez, the founder of the Beautiful Heart Foundation and the host producer of the Beautiful Heart Show at KMBT 15, Silicon Valley Community Media. I'm very pleased today to meet a very generous woman from MedShare, and I would like her to introduce herself.
My name is Susanna Gutierrez. I work here at MedShare. I'm the Med Team Program Manager. I'm here supporting Dr. Millendez, who's going on a disaster relief trip to the Philippines to support the typhoon.
During the Typhoon Haiyan, I was also given boxes and boxes of donations from MedShare with the help of Shannon. I don't know if you remember Shannon.
No, I wasn't here.
Okay, so thank you again for the support of the MedShare, and very timely because you sent me an email last night. Late in the evening, I saw it almost 7 o'clock, so I responded right away, and I'm very blessed that you guys are helping not only the Philippines, I think almost. You mentioned the disasters recently that
So
mentioned.
currently we're supporting Florence, so we're collecting lots of medical supplies, personal hygiene, patient pillows, blankets, just to keep everybody warm with the lights out. And then we're also helping the Philippines. Any medical mission team that is going to the Philippines is being provided 100 pounds donation free from MedShare.
Okay, so anybody, any organization?
Any organization.
I think I'm the first to do it.
You are the first.
Okay, but this is.
That hasn't been disclosed yet.
And I understand you also had a program for a 40-footer.
Right.
Yeah, can you mention about that?
Yes, so that would be, it's a $25,000 sponsorship to sponsor a 40-foot ocean container that you can put into exactly what you want on the container.
Okay.
Including biomedical equipment ranging from x-ray machines to blood pressure monitors, even physical therapy instruments, surgical instruments, and medical consumables.
Maybe we can show some of those equipment that is ready. Are those ready for
This is
shipment?
a shipment for...
Yeah, so
So all things that are already big boxes. And in connection to these recent donations, I think I was able to shop some milk cans that we were able to feed to the malnourished children in the Philippines. The hygiene kits were very useful because towards the end of the year last year, there was a landslide that happened in somewhere in Camarines Sur, one of the provinces, and those hygiene kits were very useful as well. Now, this is the bad news. The last week, in the second biggest island in the Philippines, Mindanao, we were hit by successive earthquakes, and there are already casualties. And I think my arrival there on November 28th again, I was there from August 21st to October 2nd, and I'll go again by November 26th. I'll arrive there on November 28th. I wish I can bring more. I'm sure the impact of the earthquake plus the forthcoming typhoons would really be very, very devastating. And I am praying to God that God will send us organizations, people with beautiful hearts to help us in our reaching out to the poorest of the poor in the Philippines. Again, happy Halloween to everybody. Thank you.
Dr. Melendez, you have time for a couple questions?
Yes.
Great. Anybody have any questions? Yes, young lady in the back.
My name is Fran.
Thank you, Fran. Nice to meet you.
When you say that you're going out to the indigenous people way far out, what kind of supplies do you usually take to them? You said you're not taking gauze or dressings or whatever. What do you do?
We encourage even used clothing and books and old shoes, school supplies. In fact, I received some books here that I donated to some nursing schools in the Philippines. So anything. The only problem is the cost of shipping, which is a typical we call it balikbayan box. It has increased the price from $50 now, it's $65 per box. But I think it's all worth it. I mean, they would love anything that would come from the United States. Even the kids would love our chocolates here. Yeah. So very timely if we will get those donations, because by then it's Christmas season, and normally during Christmas season, that's also the time where we are hit by big typhoons.
Yeah.
So a way of celebrating Christmas in a very meaningful way with the poor, affected people in the Philippines.
Great. Thank you so much. Any other questions?
She has a
Oh, yes.
Okay. Where do you collect some of the other donations for, I mean, it sounded like the books, there were some from here that might be for nursing. Were there other like books and clothing, places you've gone around this area?
You know, what's interesting is some of my clients who are hospice, and some of them finally passed away, and the family members would give those leftover medicines, you know, equipments, even their walker and their commode. So those are my donors. My own clients, my friends who are running residential care homes would also give their leftover medicines and supplies. Those are very useful. As I've said, the big one was the Brothers Brother Foundation, to the tune of $900 plus $1,000 worth of retail value of medicines. MedShare, I mean, has been regularly helping us. And of course, in the Philippines, we have local counterparts, local drugstores, and even our own Philippine Charity Sweepstakes Office. You know, this is the government agency that would manage Lotto and all that. So they would also give supplies of medicines.
The drop-off site for shoes or children's clothing or things like that? Are there local
We have not
drop-off
yet
sites?
established a drop-off site here. How I wish we can do that, but my garage right now is. I will be handling to you. I'm also the president of the San Jose Silicon Valley Global Lions Club, so I will pass on my address. I have some cards here. So my own garage, we could hardly get in. The cars are already outside. So I have some fruit. So you can drop off in our place.
You're in San Jose?
In Hayward.
Oh, in Hayward. Okay.
Yeah. Then for a typical balikbayan box that will be shipped normally 30 to 45 days before it gets there. So there's no problem with. In fact, after this, I will go to one of the churches in Palo Alto that they will be sharing some of canned goods. So those are very useful as well. Canned goods, they don't really expire. So 30 to 45 days should still be okay. Yeah, so...
Great, so we'll wrap it up. And if you want to come talk to Dr. Millendez, come up. He has got his cards. But please join me in thanking him for sharing his beautiful heart. And please, come hang out, ask questions, grab some food. But thanks again for coming into MedShare. And Dr. Millendez, again.
Thank you so much.
Salamat po.
Thank you. Again, I would like to thank MedShare for inviting me here at San Leandro. I had a short sharing of my experiences with my medical missions, of course, with the support of MedShare. And with me is Shana, who will be sharing also some more information about what MedShare is all about. And I'm so thankful also for, again, receiving donations for my forthcoming trip on November 26. Very timely that I'll be hand-carrying some food stuff and some hygiene kits. In fact, the kit will be placed here. We have some soap, we have some lotion here, and of course, Shana will tell us more about some other donations that are ready for the Philippines and some other countries that would need this stuff here.
Sure. Okay, so my name is Shana Hassol. I'm the MedShare Volunteer Program Manager in the Western region, and we host about 8,500 volunteer sessions a year. And everything that MedShare gets from our supply partners, both manufacturers and distributors and also hospitals around the Bay Area, are sorted by volunteers. If you pan around, you'll see the sort room. We have volunteers do a first sort project, which is putting everything into these really general categories. And then when we get enough of each category, then we do a second sort. And so you can get a kind of a view of our warehouse. MedShare has shipped to 105 countries, and you're seeing just some of the flags of 105 countries. The Philippines, we have sent 30 different 40-foot containers. So each one of those 40-foot containers treats about 12,500 people. And it's a mix of both medical supplies and medical equipment. And so those are really exciting containers and gifts to hospitals and clinics in the Philippines who have lower access to quality medical supplies than we do in the United States. So MedShare is respecting the dignity and providing respect to the patients that go to these hospitals and need medical care. So we do that in many different ways, through the 40-foot ocean containers that I mentioned, directly partnering with a hospital or clinic, but also through the medical supply store, which you see behind me. So physicians like Dr. Millendez can come in and get donated medical supplies. We give them a box and a shopping cart, and they just have to fill out a short application on our website, and they can have access to all these medical supplies and personal hygiene items and things like our clean birthing kit. So the clean birthing kit is designed for women who are giving birth in a rural setting outside of a medical facility, which is the majority of births in the developing world happen outside of a hospital or a clinic. And so this is an underpad for the mother to lay on, a receiving blanket for the baby, a nose aspirator, a sterile scalpel, soap for the person assisting. It's typically a friend or a family member. They can wash their hands, they put on a pair of sterile gloves, and there's 2 umbilical cord clamps for the umbilical cord, and then they're using a sterile scalpel to cut it. And so the goal of this initiative as part of our maternal and child health program is to make sure that there are safe births both for the mother and the baby. So each one of these kits saves 2 lives, and MedShare is really excited and proud to have distributed about 25,000 of these, and our goal is 100,000. So we give these to medical mission teams like Dr. Millendez, and also ship them internationally on our containers. The other use for this store is for local clinics. So we have 55 different partners here in the Bay Area who are free clinics, and it's an important safety net for those in the Bay Area who are homeless or low income, or immigrants and refugees who need access to these supplies. And so MedShare acts as a resource and a supply chain for international hospitals and local free clinics in the Bay Area, as well as medical missions that go all over the world. So we outfit about 450 medical teams a year. We've been lucky to partner with Dr. Millendez and the Beautiful Heart Foundation since 2009 and provide many different boxes and supply the medical missions. So next, my job is to invite you to come in and volunteer. So we do different projects, as you saw a couple of minutes ago, first sort and second sort. If you're a medical professional, we definitely would benefit from your expertise. But also if you're not, we do a training and an orientation, so anyone, even if you don't have medical expertise, can help us in the volunteer program. So you can join us to volunteer by going on MedShare's website. It's medshare.org/volunteer. And then you click on the region that you'd like to volunteer. If you're in the Bay Area, you'll click on Northern California. But if you're in Atlanta, Georgia, or New York or New Jersey, we also have 2 other locations. And you can, you'll be asked to create an account, and then you'll see all of our open sessions. So we do volunteer sessions from Tuesday to Saturday, both morning and afternoon, so 9 a.m. and 1 p.m. And you can just pick whatever works for your schedule. So that's what's unique about MedShare's volunteer program, is we only ask you to dedicate 3 hours, as often as you want, but that's the minimum commitment, is just a 3-hour session. So please come in and join us. If you have any questions, you can call 510-567-7070 and then press the button that's for volunteering. But many of the questions are answered on our website, medshare.org/volunteer.
Thank you.